Wellness is a healthy balance of mind, body and spirit that results in an overall feeling of well-being. It is an active process of becoming aware of and making choices towards a successful existence. Poor health and disease have become components of life, affecting humans, rendering them sometimes unable to help oneself in times of need or illness. In developing countries, poverty and disease have become a burden. Health care is far-fetched, with health facilities overstretched. Interventions of sympathizers offering free service to the terminally ill through palliative care is also rare. The emerging incurable diseases like cancer, and with no HIV cure in sight, the dying need a hospitality situation involving assistance for patients and families to cope through providing care and support. Cancer and HIV/AIDS have become a threat to many, with rural dwellers unaware of the symptoms and interventions. The offspring of the dying, the orphans, too need attention to pass through life. Therefore, creating hope for anybody going through the pains of life is what inspired Grandinho Situka, the founder of Sovereign Wings of Hope.
In 1982, my wife and I, we founded Sovereign Wings of Hope. By then, it was called Wings of Hope in Uganda, trying to reach out to the youth who are struggling, and from personal experience that we wanted to reach out to those people who have been struggling with the life and trying to find the source of hope in spite of the struggles they were going through. My mom had left when I was very young, and it was a struggle for me to get school fees and to be able to get anything to provide for me. And therefore, since she struggled a lot, I had to struggle. She was the one paying for my tuitions and everything, and that's I could feel the pain of most of the young people, what they are going through when they are going into the growing pains of life.
People in rural areas live in abject poverty, unable to access basic necessities in life. The cost of living is high, which is made worse by poor infrastructure. The feeble, sick and elderly wait to die. The disease burden is made worse by absence of medical facilities, with patients walking long distances to access treatment.
My personal experience with the loss, I realized that hope is needed more than just in the youth, but also those who are struggling with the terminal illness. So now we started an arm of providing palliative care and hospice.
When the Lord has blessed you, it is prudent of you to return to the needy. The compassion will transform life.
When I look back where I'm coming from a very humble experience, and with somebody who didn't have hope. And when I felt like the Lord has blessed me and I'm able to take care of myself, when I was in Uganda, God, before I came here, God had blessed me so much that I was able to have a great job as an administrator of International Christian Aid. And it was, during that time I felt like I can give back. But also the way the Lord blessed me coming into USA, in spite of my humble beginning, I feel like, I can help other people.
This involved caring for the needy, the orphans and the terminally ill, establishing places of hospitality for the sick, the terminally ill as well as the elderly. The activities started in the 6 districts of Busoga region and the Greater Bukedi in eastern Uganda. This is how Wings of Hope mobilizes volunteers to interact with needy children, most of whom are orphans. The interaction has granted them hope and a responsible lifestyle.
one refer as you are.
You can what?
You can refer as you and refer people
There.
all.
There are 4 of us now, and there will be one more coming in about a week. Jeremiah's wife.
In Uganda, the ratio of patient to doctor is estimated at 12,500 to a doctor and one nurse to 8,000 patients. In rural areas, the numbers increase to 15,000 patients to a single doctor. The situation is pathetic, yet the emerging diseases like cancer, HIV/AIDS, tuberculosis, diabetes and hypertension require attention of a medical doctor. This is the cause Wings of Hope has come to address, to establish hospices which can offer palliative care and give hope to the terminally ill.
Presently, as we talk now, this hospital serves about, we have said it's a 500-bed hospital, that's about 500 inpatients every day. And through our gates, we see close to about 1,000 outpatients. That is the adult, and the children. On the children's hospital, we see close to 200 children inpatient, and we see about 500 outpatient. Now, this covers all the special clinics that run in this place. It means that we have diseases that are beginning to emerge, which are non-infectious diseases, which fall in the category of the chronic illnesses. Among the chronic illnesses that we are beginning to see is the burden of cancer. Those are neoplasias in this place.
The hospices are spread out countrywide to offer palliative care to HIV/AIDS patients and cancer.
First of all, because you go when they don't have hope, the initial thinking is you've come to heal that person. You see, because they may have been sent home, because the first one were referrals. We are within Tororo hospitals, within Jinja. You know who has been discharged because the hospital gave up on them. So when they are sent home, they don't have hope.
Nevertheless, availability of medical personnel and the ability of the patient or relatives to pay for the palliative care all raise questions.
Palliative care is to come in and say, yeah, these are the last days of this patient, but let's make it as comfortable as possible for this patient, so the last days are not spent in pain, and where they can plan certain things, you prepare the whole family mentally and psychologically to understand these are the last days, help prepare the patient so that his or her last wishes can be taken on, which is very new in Uganda. People don't like to talk about it, people don't want to do that, but that was a big step in terms of the direction that Wings of Hope took.
However, increasing poverty levels and inability of families to provide proper diet or even feed families are the initial challenges to health. The increasing disease burden, however, calls for a system that will cater for the terminally ill.
When you go into palliative care, how do you measure? Because the goal is not recovery. The goal is the comfort of the patient. How do you measure how well you've done? Part of it is just interacting post the process, interact with the family members. How was it the last days? Was the patient more comfortable? Did the relatives feel comforted? It's very difficult to know how to do it, because what you really want to know that at the end of it, because the end is inevitable, that somehow this patient in this little heart was able to bear the last days much better than it would have been for him or her without that care. So a lot of it is interacting with the patient. Sometimes we spend those last days with them and be able to talk to them and say, how are they doing, And sometimes they lapse into coma, where you can no longer talk with them. But the parents and the relatives don't feel comforted that someone is there with them. This person is going through the last time. And they're able to prepare themselves, and the patient is able to prepare him or herself for the end has taken.
This was a crucial area that Wings of Hope addressed by establishing hospices in Jinja and Tororo to give attention to the terminally ill, providing care in end of life setting, and for patients with other specific palliative care needs.
This hospice was started and mandated to take palliative care to the villages and the communities in Uganda, especially the Busoga region. And for the last over 8 years, we have carried palliative care and kept the banner burning. We have taken hope to many, and we have been able to restore their dignity, and we have taken away their pain and suffering all through the work that we do.
In some of its activities, Hospice Ginger reaches out to patients who may not be able to reach the hospice premises to extend services to those in need.
Hospice Ginger operates an outreach and home-based care service. The team goes out, and at a particular moment they have a point where they stop and they are going to meet patients, and the patients are consulted there. And while a home visit is when a patient is either very ill or very poor, even to be able to travel to the nearest outreach point, and so the hospice field team drives and meets the patient in their homes.
Hospice Ginger operates in 6 of the 9 districts with a focus on palliation of the patient's pain and symptoms. They also focus on bringing comfort, self-respect and calm to patients with terminal illnesses. Hospice believes the end of life is a human experience that benefits from expert medical and holistic support. Hospice Ginger reaches out to patients at home. This is Baitambogwe in Mayogi district, where Hospice Ginger has helped John Balidawa cope with HIV/AIDS.
Buchandwala miaka 8 na dwadde nafa wano wewate nafa kakati nekwata omugo nentambula maze ebbanga ery'omwezi 7 kati nga bandetera amakerenda ne sente kakati enkyuka eriwo.
The work of palliative care nurses is always timely to save the lives of some patients. Maria Iswata is the mother of Balidawa.
Era nebaza abadokita abamukwataho ku bulamu bw'okumujanjaba nasigala ng'akyali mulamu nifwe nga tunnya naye. Ne bamutandikiza embeera yali embi nnyo ng'eralikiza buli muntu, naye kati embeera gera erongoka.
Sokole kule wano lingirire ojja kunkobera kikyendi kubisaako kiki oli kuwulira Balidawa kiki oli kuwulira wano eriyo kyoli wulira wano.
Hospice has established rapport with patients during the home care visit programs. It has instilled confidence as they pray before leaving. Hospice palliative care nurses have been backed by volunteers to extend service to patients in rural areas.
We do mobilization. We visit the cancer clients or cancer patients. We do follow-up at their homes. We sensitize them and we refer them to the doctors to access services.
It is the hope Hospice Ginger has imparted to patients. They have reached out to work with established health units to identify and interact with patients.
Bulwale bwa kisipi kyankuba kyambisa bubi aida wane mayuge wano ndwaire la gavumenti kale tilyankolera ng'ekintu kikasigaire nga kyawona kungulu kuno aye nga munda mule kikanuma nga nigandi datifuna bwidanda bulungi bandagirira abasawo imwe naida bampa obulezi bwe bampa bwali bwakunwa atandika n'obulezi obwokubunwa nabo obunankanya obulumi bwe nalina bw'obwamaanyi tebujja kebukolaki ebwikaikana.
Nebaza abasawo bano abaatuleetera eddagala nze mukuleetebwa wano nali nzira ssuubi era nga bangema ku bugemi aye essaawa eno eddagala lyange ndimira bulungi, tibange maaku, tibakola ki, buli mulimu nsobola ogwekolera. Era omwana wange owundi ali mu senior 5, owundi mu senior 3, owundi mu senior 1. Ndina eisuubi nti nda kusomesa omwana wange owa senior 1 atuuke e Makerere.
Naidange engalo eri kuno nabaawo nga kale nga ndidangayi nga tibakola ki tibangolaku nga bakuba atyo ive kati bampanga kuti kuidagala lyesi nga nesimula tukulu nume nokola ki okuyingira okumpalera amakerenda.
But just to the east of Tororo is another rising disease burden, cancer of the cervix. Hospice, operating in the region, works together with Tororo Regional Referral Hospital. They have established Hospice Tororo to provide palliative care to cancer and HIV patients. Intensified home care visits. Indeed, Hospice Tororo has returned hope to the aging who were dying silently with cancer. In Uganda, about 80% of the population live in rural areas with no health care facilities. Cancer education and screening are rare. Diagnoses come late, and treatments are often not available. The prognosis for most Ugandans with cancer is poor. Only 45% of breast cancer patients and 18% of the cervical cancer patients survive 5 years after diagnosis. This is the Greater Bukedi, where Sovereign Wings of Hope opened Hospice Tororo. It turned out to serve cancer patients. Hospice Tororo was founded by Sovereign Wings of Hope in 2012. It integrates the hospital palliative care with the community-based palliative care.
Most of our patients are suffering from cancer. About 75% of our patients have cancer, either diagnosed or highly suspected cancer. All kind of types of cancer, and a smaller group has a combination between HIV/AIDS and cancer, and other smaller group again has only HIV/AIDS, and there are a few other diseases that we also take care of, but the biggest group is people with cancer. And Hospice Tororo covers the whole former Bukede region, the eastern region, 7 districts, and we see a lot of people with cancer there. Yet the access to cancer treatment, like here in Kampala and Mulago, is very difficult for them to get there. There's no money for transport, there's no money for upkeep, and yet there are no other healthcare systems in place in the eastern region where they can get treatment from.
Wings of Hope has brought volunteers to help in Tororo, which serves the old Bukedi region. This is the Cancer Clinic, Tororo Regional Referral Hospital. At this clinic, most patients report different cases of cancer, heightened by breast cancer and cancer of the cervix. Besides cancer at Tororo Hospital, 100 patients report cases of HIV/AIDS daily. Cancer got communities in this region by surprise. It is associated with several misfortunes, including witchcraft. Patients report late. Caretakers fear cancer, like the caretakers of this little girl, Annette, who is 14 years. She was abandoned. There are other cancer cases, both within and outside the hospital, which have become an occupation of the palliative care nurses and engaged both home care nurses and the volunteers. Evelyn Adongo is 60 years and has been at hospital for 11 days.
Here we are treating her for a urinary tract infection. She has a cancer of the cervix, that's why she's on the palliative care program. Then, when she was home, she developed another infection, that's why she's admitted here.
There are challenges to this work of offering palliative care and reaching out to the communities.
We have a challenge of transport. We are using at this moment bodas to travel, which means it is not that safe. There is a lot of dust. If it's rain season, there is a lot of mud. We can't access roads on the boda in the rain season. That's a big challenge.
outreach home care nurses supported by volunteers ride distances to reach the patients in the villages. These visits enable terminally ill patients to receive counseling and drugs.
Now, the problem he has, there is a swelling around here where the pipe for urine gets out, and then it enters around where the store for urine is. So now that swelling presses on this pipe for urine. That is why he feels a lot of pain when he's going to pass urine.
These are severe cases of cancer whose diagnosis is delayed. However, hospice offers palliative care, delivering medicine and counseling. The lease for life which Hospice Tororo has given Jennifer gives her to appreciate the service.
Jennifer has a problem. She has cancer of the cervix, which is advanced and which has invaded also other organs.
Hospice Tororo home visit nurses have mapped their clients. Unlike other services that are paid for by other service providers, Hospice Tororo service is entirely free of charge. Nantabo Sarah is 38 years old.
Abo bali kunamba bali kundetera kuku wano idagala eriri kunamba amakerendano obulezi obwokunwa bwe ndi kukozzaako obulezi obwo ndi kuwulira nga nja obulumi bukendeera kuumu n'omusaayi ogwayiyikanga guli kujanga gukendeera kuumu aye nga guli mu wiiki oti ndala aye wiiki egy'okuwaaku nga guli kumbisawo bino aye nga tugulinga wali kuba gwalinga mwezi ku mwezi.
In Uganda, the outbreak of HIV/AIDS has left widows, widowers and orphans, and child-headed families. Yet, there are no resources to cater for these infected and affected by the disease. On the other hand, keeping children focused on human dignity is paramount. After all activity, the volunteers interact with the students and represent the grace of God. The ministry mobilizes youth and children, provide them life skills. At Pastor Oite Ministries in Tororo, the founder explains. Wings of Hope solicits volunteers to work in communities. This gives opportunity to interact with communities at personal level. They are passionate with their work and they have improved outreach. This scenario has left orphans, which Wings of Hope has sought to address. The partnership with Smiles Africa has restored hope. This home tells the impact of disease and poverty on families. However, the work of volunteers can't be underestimated. Sovereign Wings of Hope has provided volunteers an opportunity to work with communities. They work, joke, and play with communities without fear. It gives hope that the interaction is deeply rooted.